name is Dr. Marc Riedl. I'm a physician and an associate professor at the UCLA School of Medicine in Los Angeles, California. One of the major challenges with hereditary angioedema is that it is an uncommon condition, but it presents with very common symptoms. So one of the things I hear over and over from patients is that it takes a very long time for them to get the proper diagnosis. They see many physicians, they go to many experts and specialists, but that raising awareness of this condition in the medical community is really one of the top priorities that we have. The Hereditary Angioedema Association, so both the international and the US-based group, have been tremendous advocates for patients, for individuals with HAE. And that works at a number of levels. I think importantly, they are very active in education, education for both healthcare providers and for individuals with this condition, families that have HAE. They've been active on the advocacy front at the government level to get the medications that we have covered by payers, whether that's the government or private insurers. And I think the other thing that these organizations have done is provided support for individuals with HAE, and you really can't say enough about the type of support that's needed when people have a lifelong chronic condition. I think the single biggest task that we need to try to accomplish is that everyone has access to some effective treatment for HAE. The other important priority, though, is learning how to use these medications in the best way possible, and this is not a one-size-fits-all condition because of the variability. So using the tools that we now have in our toolkit, I think physicians and researchers have to learn how to best tailor treatment for each individual based on their situation and their symptoms. Educational efforts surrounding HAE need to increase, certainly. There's really no end to the amount of education that needs to take place, and I think this will improve the delay in diagnosis, this will improve the misdiagnosis and the lack of effective treatment provided that we see over and over, unfortunately, with uncommon conditions. So I think one of the real benefits of HAE Day is that you do have this education component, and the more people we educate at an event like this, they can go out and sort of spread the word, if you will. If I could ask a patient to do one thing for HAE Day, it would honestly be tell a friend about it. Just telling them about the day may be enough for them to realize that we need to recognize this condition and what these families go through. There are a number of areas where we can continue to improve things for people with HAE, but I guess if I could sum it up in one word, it would be, or a couple words, is building community. We need that community to figure out how to do things better from a scientific standpoint.